Imagine yourself as a doctor in the emergency room when the scenario pops up. It's an ordinary morning at the hospital when a 16-year-old boy visiting his younger sibling in the pediatric ward decides to grab a quick snack from the hospital cafeteria. He buys a pack of roasted peanuts, something that he has unknowingly avoided all his life. Within just a few minutes of eating, he starts to feel an intense itching in his throat. His lips and eyelids begin to swell, and he complains of a tight sensation in his chest and rapidly develops the wheezing and severe shortness of breath. The paramedics have arrived him to the hospital emergency room, and the nurses notice that he is flushed, visibly distressed, and struggling to breathe. His blood pressure has plummeted to 85 by 50 mm of Hg. His heart rate is racing at 130 beats per minute, and the hives are spreading rapidly across his chest and arms. This is not a mild allergic reaction. This is anaphylactic shock, which is a life threatening systemic hypersensitivity reaction that demands the immediate intervention. If you are someone who struggles to deal with the emergency cases like this, you are at the right place. Stay with me as we unravel this medical emergency step by step and ensure that you are fully prepared to recognize and manage anaphylaxis whenever and wherever it strikes. In this course, we are going to have the different modules. The module number 1 will be about the introduction to anaphylaxis. We would be studying about the course introduction, including the objectives, the importance of early recognition and management, and the overview of real-life clinical impact. Module 2 is going to be about the pathophysiology, in which we will study about the hypersensitivity reaction and where does the anaphylaxis fit into it. We will also study about the immunopathogenesis of the anaphylactic shock and the homodynamics, which will be explained in detail. Module 3 is going to be about the clinical presentation and diagnosis, in which we will be recognizing the anaphylaxis shock, and we will also study about the diagnostic criteria according to the World Allergy Organization and an IAD-FAN guideline. Module 4 is going to be about the emergency management, including the ABC approach to anaphylaxis, the first line treatment, which is epinephrine, and the adjunctive therapies. Later modules will include the prevention and long term management and the special scenarios. So let's get started.